Hi everyone, I am Kevin Niconyate and today I will be presenting to you a visual presentation of how I would answer into different interview questions. So first question for this part is, tell me about an event that challenged you. How did you meet the challenge? If you would do it all over again, what would you do differently? So when I was working at a tertiary hospital and I was assigned as the senior staff role in a department, I was given the task to make decisions for the team. There was a time when the laboratory information system or the LIS got errors and went to an unscheduled maintenance. Therefore, the results from the laboratory were not transmitted to the hospital health system. So I decided to call every result to the emergency department while printing the other results for the different wards other than the emergency department and deliver to them every 4 hours. This led to the other critical departments such as the intensive care unit or the ICU making complaints of the delayed results. If I had to do it all over again, I would reconsider every component of the hospital and the laboratory in order to deliver quality and fast results. First is that I will utilize our fax machine or the hospital printer system. Each of the departments has or wards in the hospital has a fax machine or a printer system in their nursing section, and therefore results generated can be faxed or printed from the laboratory to the different wards and can be confirmed through the phone once received. For this plan to work, I would have to work with the information technology department. Moreover, staffing would be should be made in a way that there is a buffer each day. This means that whenever there is a greater need, there should be a staff that can be adjusted in the schedule to fill in the greater need. This solution should be with the consent of the staff involved and should not be enforced or forcibly done. Second question for this interview is, if you and a colleague had a difference in opinion, how would you go about resolving it? In my opinion, it is perfectly okay to have an opinion that may not vibe with the colleagues. However, how one handle an opposing a point should be taken into consideration. Disagreement should never be mistaken for disrespect. People are allowed to disagree with each other, but that doesn't mean that they should disrespect each other too. The situation doesn't give someone the right to belittle, shame, or disrespect the other. Valuing the right to differ and differences in the opinion can be beneficial, but respect needs to be the center of the conversation. If me and my colleague had a difference in opinion in a certain matter, I will try to put myself in their shoes and feel how they came up to that opinion and compare it with my own opinion. I will try to I will try as much as I can to understand their point of view. Moreover, if the disagreement are being or is being deep already, it is better to do it or to do the discussion and explanations in private. When I was working at a tertiary hospital, a certain situation in laboratory where a coworker disagreed about the requirements for filling the collection tube for a site-treated blood that led to disagreements and differences in opinion. The client was confused because me and my colleague told them a different guideline. I did not accept the sample as I considered it short from the required specimen volume, but my coworker accepted it. I started looking into the standard operating procedure or the SOP, which shed some light regarding the matter. The protocol stated that the collection tube must be filled and should not go below the minimum line. Um, Moreover, the standard operating procedure explained that going below the minimum line will affect the results and the blood will be diluted, and therefore the results will not be reliable and may affect patient diagnosis and treatment or intervention. After reading this, I showed it to my coworker, and she understood my point correctly. From then on, she said that she will not process an unacceptable sample per our SOP. It was also discussed in our daily huddle to inform everyone and to have uniformity in the guidelines. As a result, we didn't experience client complaints who were disappointed with the different rules we follow regarding the required volume. Interview question number 3. Explain a time you were given short notice to come up with a solution to an ongoing problem. What process did you use to come up with a solution? So working in a stat department where we need to release the results 90 minutes after receiving in the laboratory, every situation or event warrants the need for a fast and concise decision. When I started taking the role of shift supervisor in an afternoon shift, a new clinical laboratory scientist or CLS made a mistake in releasing the erythrocyte sedimentation rate result of a patient. She came to me and asked me on what to do since it was released already an hour ago in the system. As an immediate action, I double checked the results that was printed by the instrument and compared it with the patient identification of the sample. When I found it was matching, I called the client and explained to them the scenario and advised them to hold the results for the meantime as we are repeating the result to confirm the accuracy and the reliability of the results. So based on the repeated analysis, the initial result was wrong and the result was revised by my coworker in our system. The client was informed that the results were revised and we sent them another copy of the revised report. As for the immediate solution to the problem, we started to have manual type orders to the LIS being verified by 2 different CLS before it should be released into the system. Moreover, an automatic transmission from the instrument to the laboratory information system was requested for installation to avoid the occurrence of typographical errors related to manually entering results into the systems. Since then, we have lesser to almost none typographical error events in the laboratory results. The next interview question is, what is your management style? Why is your management style best fits your position? So I embrace the transformational leadership style as a leader. Transformational leadership is defined as a leadership approach that cause a change in individual social systems. In its ideal form, it creates valuable and positive change in the followers with the end goal of developing followers into leaders. In my workplace setting, where I'm seen as one of the senior clinical laboratory scientists, they expect me to become an agent of change, innovation, and become an inspirational to others. In the company, I function as a shift supervisor who oversees the whole production in the afternoon shift. I see to it that there is a smooth flow in the workplace and that the problems are well taken care of. Working in the laboratory, I teach other employees how to deal with different scenarios, explaining to them every pros and cons and the techniques on how to deal with it. This way, I can motivate them to know more and acquire more skills, knowledge, and understanding in their working environment. Moreover, I am transforming them to become leaders of their own in their own terms in decision making. As a transformational leader, I also embrace a change within the company. Example of which is annual CLS competency assessments in different analyzer that was used in our company were done in paperwork before. However, with the advancement of technology, we changed it to electronics where they can do their competencies in online platform. Technical supervisor and employees can sign off their competency as they do it in real time. Moreover, the examination was given to us to assess their full understanding of the analyzer and its use. This prevented employees from copying with each other or from copying with each other since randomized questions were given from a huge question bank. This change gives much importance to the determination of the full understanding of employees in what they do in the laboratory. Next question is, what is your greatest accomplishment that you are proud of? Every patient result is important in the diagnosis and treatment of procedures. When I was starting as a CLS in a rapid response laboratory under the Quest Diagnostics, I was taught to not accept the samples that were hemolyzed, icteric, or lipemic. Tests will not be done, and the client will receive a result and stating that the samples were compromised due to the nature of the samples, such as hemolysis, lipemic, or icteric. As a result, the sample had to be collected again, where outpatient department have to call back the patients for a possible redraw. This will delay the diagnosis and the treatment procedure for the patient. When I was browsing through the different standard operating procedures, I found that samples that were hemolyzed, lipemic, or icteric must be graded according to the severity of each. It should be graded 1, 2, 3, 4, or 5. Moreover, based on the grades, there will be 3 possible scenarios. First is that results can be released as it is. Second is that results will be released with a specific comment in their values. And the third will be tests will not be performed at all. The challenge was the different tests have different criteria for reporting when sample is problematic. We discussed in our daily huddle and we followed what was stated in the SOP per analyte. However, whenever there was a problematic sample or a hemolyzed sample was received in the laboratory, the CLS takes a lot of time browsing through the different SOPs of each analyte for the proper releasing of the results. 2 problems now arouse in a situation. First is that there is an improper reporting when CLS just release the result or just don't release the result at all when there is a problematic sample. And the second was when the CLS not meeting the turnaround time due to the intensive or extensive time being consumed looking into the different SOPs. The situation has led me to create a single file summarizing all the reporting criteria when samples are hemolyzed, icteric, or lipemic. In this Excel file, the severity grade of hemolysis, icterus, or lipemia was separated in a single column, and the different analyzed on different rows. Therefore, when a CLS determined that the grade of a sample problem already, the CLS will only look at one column and will find how the reporting will be done on each analyte. This process removed the extensive time and effort browsing to the different SOPs per analyte, and as a result, we never experienced late in turnaround time due to the delayed reporting related to the problematic sample, and we never experienced a case of improper reporting due to not grading the severity of the problem sample and the not following the reporting criteria per the standard operating procedure. For me, as a CLS in a rapid response laboratory, this is an accomplishment since it relates to our goal of delivering quality and reliable results as soon as we can. Quality and reliability were done because we followed the SOP and results were released in a timely manner. Moreover, the project was also shared with different departments from different locations which they utilized too, and it helped them in their turnaround time too when they are dealing with the problematic samples. So thank you guys for listening, and this is Kevin Niconyate.